For more than 5 decades, Nicholas Freudenberg has been at the forefront of some of the most consequential public health movements in America. As the distinguished professor emeritus of public health at the City of New York University, CUNY, he has dedicated his career to understanding and transforming the social, political, and economic forces which shape public health outcomes. In this compelling and thought-provoking episode of Let's Have This Conversation, Nicholas shares why improving public health extends well beyond advances in medicine. It requires courageous leadership, community activism, policy reform, and a willingness to challenge systems that perpetuate inequality. Our conversation explores the evolution of public health activism through the lens of some of society's most pressing issues, including childhood lead poisoning, the HIV and AIDS prevention, drug policy and harm reduction, food insecurity and nutrition equality, housing and environmental justice, labor rights and workplace health, mass incarceration and its impact on communities, corporate influence on public health, and finally, the future of health activism in America. Freudenberg also discusses his new book, Fighting for New York, Activism for Health and Social Justice. Since the 1960s, it chronicles decades of grassroots organizing and reveals the lessons that today's leaders, advocates, educators, and policymakers can apply to create healthier and more equitable communities at large. As the founder of CUNY's Urban Food Policy Institute, the Hunter College Center on AIDS, Drugs, and Community Health, and the university-wide Healthy CUNY Initiative, Nicholas has spent a lifetime turning research into action. His work demonstrates that meaningful social change occurs when academic knowledge, community engagement, and good public policy all come together. Whether you're a public health professional, healthcare leader, policymaker, social justice advocate, nonprofit executive, a student, or simply someone concerned about creating healthier communities, this conversation offers valuable insights on how collective action can improve lives and shape more than society. And my conversation with Freudenberg starts right now. I'm Kevin McShann. Let's have this conversation. Professor, if you're ready, I'll take a moment to welcome you to the program, and I'm super excited to learn all about your journey in public health. Great to see you, and happy Monday to you, my friend.
Great to be here. Thank you.
Absolutely. So, Professor, I wanted our first question to you this morning to just give you an overview and sort of your opportunity to tell me, when you look at the quality of public health today, how would you characterize the state of it, my friend?
Well, I think I've been doing public health work for more than 50 years. And I have to say, this summer, I am more concerned about the future of public health than I've been over the course of my career. And there's a twofold reason for my concern. One is that there are a series of threats to health emerging in the United States and around the world. New epidemics of infectious diseases, the explosive diarrhea we've been reading about that's related to food poisoning, hantavirus, Ebola. The threats from climate change have never been more acute. The forest fires related to drought, polluting the air, the extreme temperatures. And then I think what we're seeing playing out in real time is that millions of American people are being cut off from SNAP, food stamps, and Medicaid, the two programs that are the most important protectors against the harmful health effects of poverty in this country. And at the same time, we're seeing the capacity, particularly of the federal government, to respond to public health threats being undermined by cuts in staffing, in funding, in regulations. So I'm worried. And that is in part why I wrote this book, because I think that activists for a long time have been the most vital protector of public health in this country. And so I'm very worried, but I see some hope as well.
Absolutely. So, Professor, I'm also curious to ask you about healthcare equity and equality because, healthcare isn't equal for all of us, as you were just discussing. So, how do you think we can redefine healthcare equity to make sure that every American and every citizen, for that matter, has access to healthcare that's equitable and inclusive, my friend? What are your thoughts there?
Thanks for that question, a really important one. Before I answer, I want to make a distinction between health care, which is being able to get the care you need from doctors and other providers, and health and public health, which is having access to healthy food, safe housing, air you can breathe. And both things are important. And in this country, there are stark inequities by race, ethnicity, class, gender, urban, rural, and so on. So let me talk about, to speak to your question about health care, but I also want to make sure we talk about health and public health as well. And the sad reality is, in the United States, unlike so many other countries in the world, we have not established a system that makes the right to health care a universal right in this country. And instead, people's access to health care depends on their income, on their insurance status. And again, the trend that has alarmed me in the last couple decades is the increasing financialization of our healthcare system. And so more and more of the institutions that control our health system, our healthcare system, the insurance companies, the pharmaceutical companies, the medical care suppliers, their driving force is looking for profit, not ensuring the health of American people. And so anybody with less resources is forced to really go to the back of the line and to not have access to the best health care because they don't have the resources. And the providers who provide the best health care, the highest quality health care, are often those most focused on making a profit. And that has resulted in what some people call a medical apartheid system, where your race or your class or your income depends on the quality of health care you get. And some people get less and some people get more. That's a choice that most other countries in the world have rejected. And here in the United States, we spend more on healthcare than any other country, but we get less results for it. And I think my hope is the 26 and the 28 elections will provide an opportunity for the American people to say, we want elected leaders who are able to say no to big corporations who want to make money on our health care. And we want elected officials who will choose to bring us into the civilized world in creating a healthcare system where all people have access.
And Professor, do you ever see a world where the American people will have access to universal health care? Like I live in Canada, so we have access to that. But do you ever see a world where Americans will be awarded that same fortune, my friend?
Yes, I do. And I think the reasons I believe that are one, every other democracy, many of them also market systems, capitalist systems, have found a way to do that, to do much better than the United States in making care available. And number two, the majority of American people support a strong government role in ensuring access to health care. So every other country does it, most American people support it. So the question we face, and it will not be a quick or easy victory, is to bring us up to the rest of the civilized world and to realize the potential of our democracy of electing people to Congress and the White House and our local and state governments who have the commitment and who have the backbone to stand up to these big companies and to say, no, we're not willing to put your profits ahead of people's health. I think it will be both an incremental fight where you make one advance, and there's some ways that the Affordable Care Act was a step forward, and there are other ways that that the creators of the Affordable Care Act made compromises with insurance companies and pharmaceutical companies that limited the potential of that step forward. So our fight is cut out for us, but I think the fact that so many other countries do it and the fact that American people support it makes me optimistic.
Yeah, and Professor, you've been on the forefront of a lot of public health, uh, you know, uh, battles throughout the years, whether it's childhood lead poisoning, AIDS prevention, food policy, mass incarceration, or community organizing. And I'm curious, what did those experiences teach you between the difference between researching a social problem or an issue that comes up socially versus actually addressing the problem and coming up with a tangible solution? What do you think the difference is there, my friend?
That's a great question, Kevin. Thank you for it. And I think, uh, you know, in the academic world that I've been for many decades, the belief of many is that those worlds, the world of science and evidence and the world of changing policy and activism, are two separate worlds. But my view is different. And I think the advances in public health in this country and in the world have come about when activists and researchers work together. And I look at the advances in health and safety in the workplace, dependent so heavily on the labor movement, as well as the research of scientists who say, well, this is safe and this is dangerous, that if you're exposed to asbestos, you'll get these diseases. So I think we need to combine those two streams, and that's what I've been working on. And my book, Fighting for New York, is an effort to explain how in New York City, those two constituencies, researchers, health professionals, and activists, have worked together, and when there have been conflicts and how those get resolved. So I see them in the long run as one and the same fight, that we're in it together.
Yeah, absolutely. And Professor, I'm also curious to ask you about your book, fighting for New York. I know that you did extensive amounts of research for it on public policy and public health and your own lived experience. So tell me about the book, why you decided to write it, and the message you're hoping to convey after people finish reading it. Tell me more, my friend.
Sure. So I think there are a few key messages. Uh, as someone, the book is focused on New York, but I think New York has a long history of being both the starting place of many of the most serious public health problems facing the United States and really the world, and also a cradle for public health innovation. So my hope was by focusing on New York, I could learn lessons that would be relevant both from our successes and failures for other cities and other places in the world, including countries like Canada and the UK and South Africa and so on. There are important differences among those places, but they face many of the same problems. The second reason I wanted to write the book is from my teaching and my work in activism, and this is particularly true in recent years. I think a lot of people have gotten very discouraged about the possibility of bringing about change. They think, well, there is no alternative to the existing world. And therefore, being an activist isn't worth it because we're not going to succeed. And I think the work that led me to want to write this book to counter that message is first that many of the most significant improvements in health in New York City and in the United States came about as a result of activism. So I saw the reverse, that when activists get together, they can make changes. Take, for example, the Fight for 15 movement, which looked to bring up the minimum wage for low-wage workers in New York and later in the United States. And by pointing out the importance of people earning enough to be able to afford food, healthcare, safe housing, that the minimum wage became a health issue. And by organizing workers and enlisting legislators and mobilizing communities, first in New York City and then in New York State, and then in, I believe now, 27 states and dozens of cities, we now have a minimum wage of at least $15 an hour. And as a result, millions of workers are earning billions of dollars more a year collectively as a result of those increases and better able to afford healthier food, healthcare, transportation, housing, and so on. So I see those successes, and to me, that is a response to the pessimism. And finally, as I said earlier, I see these new threats to health around climate change, around infectious diseases, around the dismantling of the public health and healthcare systems here in the United States under the Trump administration. And I thought never has it been more important to say, well, what can we do about this? And how can we in this country restore and in fact improve our public health and healthcare systems?
And Professor, since you brought it up, I'm gonna follow up with one follow up to what you just said in terms of the information that we're putting out. How dangerous do you think the political rhetoric has become around healthcare, and how dangerous do you think it is people that are starting to believe or have a sustained belief on what the government is telling them about healthcare? I mean, when you look at Robert F. Kennedy Jr., he's not exactly the poster child for taking great health advice. He's not even a doctor. So I'm curious about asking you about the dangers when it comes to public health, misinformation, and combating it to telling the public the truth about public health. How important do you think that is, my friend?
Really, really important. But I think the much of the public and national discourse has missed some of the distinctions we need to make. So I think good public health policy has to be based on scientific evidence. And we need to know whether something is going to be harmful or helpful or neither. And that we have procedures for establishing that. And I think the efforts by RFK Jr., for example, and Trump and many others to discredit science, to demonize scientific evidence is a very dangerous trend. But on the other hand, I think we also need to acknowledge that others have misused science. If we look at the tobacco industry or the food industry or the fossil fuel industry, they've attempted to co-opt and corrupt scientists to create evidence that supports their efforts to protect their business and to protect their profits. And so the fact that someone says they're a scientist or something is science doesn't stop. We need to critically examine that evidence. And that is something we in the public and those of us who are researchers and scientists have to communicate with the public. Well, how do we decide what's good evidence and what isn't evidence? And that leads me to the third point that your question raised for me, which is I think health is political. Who's healthy and who's sick depends on who has power and wealth. And the decisions about health and public health are political decisions, but they should be based on evidence and values, not on conspiracy theories, not on ideology. And that is what makes me very worried about this country. And I think your question reflected that concern, that we tend to make decisions based on ideology and conspiracy theories rather than evidence and values. And the value that I think public health puts forward is the well-being of the population comes before making profit, comes before the partisan interests of any political group. And we need to make some progress in making those distinctions in this country.
Yeah, and part of the way that you've done that is you founded the CUNY Urban Food Policy Institute and the Hunter Collins Center for AIDS and Drugs and Community Health, and you also led the Healthy CUNY to improve student health and academic success initiative across one of the nation's largest public health or public university systems, rather. So when you look back on all of those initiatives and accomplishments, what accomplishments do you think has made you the proudest and the most significant advancement on how students look at public health? What are your thoughts there, my friend?
Sure. Well, again, I'll point to a few things. First, I'm just so proud of my students, and I've educated hundreds, maybe thousands of people over the decades I've been teaching. And I've learned so much from those students. A lot of what is reflected in my book, Fighting for New York, are the lessons I learned about activism in New York from my students who were themselves activists. And so I think I've learned about the importance of understanding, speaking to, communicating with people who are on the front lines. I think another important lesson is to tap into the power of universities and institutions of higher education. I've seen over the course of my efforts by, again, partisan groups, industry, certain sectors of government to hijack institutions of higher education to advance their agenda around, what some people call neoliberalism, around the expertise and individual responsibility, around the market economy, rather than evidence and the well-being of people. And so I'm really pleased to have been part of a university, City University of New York, that stands for a different view of the university, and being able to, in the modest ways I've been able to, win resources to make them available to communities and frontline healthcare workers to use knowledge and teaching to advance human health rather than a particular ideology. And I think another role of people like me and other academics and activists is to introduce new ideas into the political discourse. So I've been involved with other health professionals in developing a field of study called corporate or commercial determinants of health. And I started working on this maybe 20 years ago. And in the last few years, in the mainstream of public health, people have now started to understand and study and document what are the influences of the tobacco industry, the fossil fuel industry, the processed food industry on population well-being. And there are a bunch of us who brought that forward, but I feel both proud and sense of responsibility for bringing new ideas into the public arena and educating the public so that we can better protect human well-being and the environment than when those ideas were less well known.
Yeah, and one of the arguments, or one of the main points that you make, Professor, is that health is much more than medical advancement. It requires, all of us to think about things like wages, health, housing, education, food system, and food pricing, and even climate. And I'm wondering, you say when people view the conversation about healthcare through those lenses, the conversation changes dramatically, and I tend to agree with you. So I'm curious to ask you why you think people need to be invested in more than the medical advancements when it comes to healthcare. What are your thoughts there, my friend?
Yes, and I think two things lead me to understanding what people in public health call the social determinants of health: food, housing, healthcare, clean air, safe work. I think there is a growing body of research evidence that that those social determinants of health are fundamental causes of the differences in health and disease among different populations and different time periods. So if we want to achieve our society's full potential for health, we need to focus on how to provide access to those social determinants of health, food, housing, healthcare, to more and more of the population. That is one reason. The other reason is, I think part of the reason our focus has been on medical care and on individual behavior, what people eat, cigarette smoking, alcohol use, physical activity. Those individual behaviors are important, but many of us don't have full control over those things. Those things are shaped by public policies, by how we design our cities, by how our public transportation system works. So I think we need public policies that make it easy to make the healthy choice rather than, as it is too often now, you need to go to a lot of effort to find healthy food, to exercise more. We ought to be making those choices easy choices, and that's what public policy should be. And that's a different view of healthcare than getting people the most effective drug or getting them to change their individual behaviors day to day. All three of those things are important, but I think it's the fundamental causes that we need to be focusing on.
Yeah, and I know, Professor, you spent years studying things like food justice and food policy. So when we talk about the safety of our food and activism today, what do you think that looks like in practice when we talk about food safety and advocating for the safe consumption of food beyond paying attention to things like recalls and how ordinary Americans can become more informed participants when it comes to being active and transparent when it comes to food safety. What are your thoughts there?
Yes, and I think we have a very sharp example that speaks to that question in the United States today. There's been outbreaks of what some people call explosive diarrhea, cryptosporiasis, infectious disease, as a result of the food that some big food chains used in their production of the food served in fast food outlets. And I think if we take just one step back, and so in 40 states, there have been outbreaks. There's been an outbreak in New York City that sent hundreds of people to the hospital. So we have a very clear idea of when there are failures in the food safety system, people get sick, some people die, people have to go to the hospital. If we take one step back, what we've seen happening in the last 2 years is the federal government under Trump laid off thousands of people working on food safety and food research. And so our system to look at that, they cut back funding for state and local health departments who also monitor food safety. They withdrew regulations and limited enforcement of those regulations. So when the government takes a vacation from its responsibilities for protecting the food supply, people get sick. And that's what we've learned when we have a government who is both focused on improving its own well-being and the well-being of its billionaire supporters, and on cutting back government so it can give tax cuts to the wealthy. We see the consequences, in this case, in a more dangerous food supply. So that is a short answer that comes just from the last few weeks.
Yeah, absolutely, and build on your last point. Recent Gallup polling, Professor, found that approximately 53% of Americans expressed, confidence in the federal government's ability to regulate food safety, which is a historic low, and public trust has become more difficult to earn when it comes to the government's transparency when it comes to food safety. So, in your view, I'm curious, what do those declines tell us about the state of public food safety and the government's ability to communicate a unified and truthful message? What are your thoughts on the recent polling numbers, my friend?
Yes. Again, a really important question. And I think it speaks to what we were talking about earlier about how politics shapes health and the distribution of health. And I think in the case of food, we have a government that's stepping back from its responsibility to ensure that the food supply is safe. The United States began to create a system to regulate food in the early part of the 20th century, and we were in the forefront. But in the last few years, the government has stepped back from that responsibility, and who stepped forward? Industry. And in the case of the food industry, they have said, we're the ones who determine what Americans should eat, what they know about food. The sad fact is, in the United States today, people learn more about food from advertisers, from the very companies that are trying to sell their products that we often know lead to preventable illness and premature death, rather than from nutritionists or educators who could help people make more informed choices. And that is why in my book, I emphasize the importance of activists and connecting this back to politics, because I think what we need are elected officials who have the backbone to stand up to the food industry, to say, even if you make a campaign contribution, my priority is going to be to have food regulations, food agencies at the local, state, and national level that enforce the food safety, that protect American people from food poisoning and toxic substances in the food. And you, the food industry, are not capable of making that your priority because your priority is to make a profit. And I think it's activists are best equipped to bring that message to our elected officials that we want you to ensure a safe food supply. And if you don't do that, we're not going to vote for you in 26 or 28. And if we don't have a president who makes improving our food a priority, we're going to get ourselves a new president.
Yeah, and my friend, you spent so many years, evaluating the concept of social justice and its impact on society. And I'm curious, in today's polarized, political and a societal environment, I'm curious, how do you think that a concept of social justice has evolved, and how do you really believe the modern definition of being an effective social justice advocate has also evolved? What are your thoughts on the evolution of the concept of social justice, my friend?
Yes, I think the successful activists and my book, Fighting for New York, is my effort to define what successful activism is as a result of looking at 60 years of activism in New York, some of which was effective, some of which was less effective. And I think successful activists find the right balance between talking about big ideas like social justice and equity, really important concepts, and the day-to-day experiences of ordinary people, being able to feed your children, being able to give them a diet that will sustain health instead of undermine it, that will leave them hungry or put them at risk of obesity, something that has the potential to jeopardize their health over their lifetime. And I think it's the combination of being able to tap into people's experience around food, housing, what does it take to be able to have housing that you can afford, that you don't have to worry about being evicted, that you don't have to worry about the next rent increase, and being confident that your children will have as good or better a future than you have. And so I think activists, successful activists, put those big ideas like social justice and equity together with, okay, let's ensure that we can raise our kids to be healthy, that their tomorrow will be better than today. That's what I think we need to be able to do. And when we can, what I've seen about activism in New York City, when groups can explain the connection between those two things, they win people over. They enable people to act in the political arena to bring about important changes in policy. And so many of our improvements in New York City around food, housing, healthcare have come about as a result of successful activist movements that got policies to change.
Yeah, absolutely. And we talk about the idea of meaningful change, whether it be social justice, healthcare, or equality in general. You argue that meaningful change means more than just passion. It requires activism in terms of writing campaigns and also built through social strategy and social strategy and people coalition building. So I'm curious, how do you think meaningful change will be measured going forward? And what's our message to people about the importance of not only the midterms but stay activated after the election season has come and gone, my friend? So what are your a message to people about being persistent about meaningful change, my friend?
Yes, I think I'll talk about a few things that I highlight in the book that I've determined to be important. I think really significant for bringing about change is being able to bring together the different constituencies that are affected by a problem, to speak in one voice, to build the power needed to win to win against those who benefit from the status quo. And to give an example from my work and the work of other activists on childhood lead poisoning, when lead poisoning activists brought together parents concerned about their own child's exposure to lead, tenants concerned about their landlord not keeping up the apartment, teachers concerned about the ability of children in their classroom to learn without having their brain and nervous system damaged by exposure to toxins, health professionals who wanted to protect the health of the children they took care of. That coalition was able to speak to the landlords who wanted to maintain the status quo and not have to spend the money to ensure that the apartments where their tenants lived weren't spreading lead poisoning. So I think being able to build coalitions and frame an argument that builds political power is really important. And the other thing, I think, is to be able to work both inside the political system and outside the political system. As you said, the 2026 midterm election in just a few months from now and the 2028 presidential election provide the opportunity to bring together concerns about many things that are troubling the American people. The actions of our immigration authorities, ICE, in needlessly shooting people, in creating havoc and fear and mental health problems in communities around the country. That's an issue that a majority of Americans believe that the current policies are inhuman and go way too far. Another example of what is mobilizing people. A lot of people are concerned about the big data centers that are needed by the tech companies to support their artificial intelligence initiatives. And they're leading to higher electric costs, polluted water, damaging the economy by shifting it from more jobs to fewer jobs. So I think we need to look at the things that are concerning people around the country and bring them together in a focused agenda in 26 and 28 that will allow a different vision of this country than what's coming from Washington today. The vision coming from Washington today is get what you can for yourself. And what we need is a vision of government that looks to protect the well-being of all people and looks to make America an example for the world rather than a place that people are embarrassed to look at.
Yeah, and Professor, my final question for you this morning has to do with legacy of yourself and how you want your personal and professional legacy to be defined. But secondarily, I'm also curious to end by asking you about, the standing in America in terms of America's standing in being a beacon of how public health can be perceived, and just giving me a final note about, where you think America has come and where you think they still need to go when it comes to public health.
Yes, so I've been politically active for I think about 60 years now, and I've seen a lot of good things and a lot of bad things. We saw the election of Ronald Reagan, of Richard Nixon, of George Bush, people who advanced ideas that in many cases undermined public health. And we've seen the election of other people. We recently elected a new mayor in New York City, Zohran Mamdani, who stands for a different approach. A bunch of years ago, we saw the country elect its first black president, someone who said, that we can hope, that hope is an American legacy. So we've seen some good things and some bad things, and nothing solves the problem. There are no magic bullets, and so there is a potential in 26 and 28 to end a very troubling era that looked to undermine public health and healthcare. And if my work and my words and my students can help to lead to that new era, what a great accomplishment. The particular task of my book, Fighting for New York, is to say we have an activist legacy and we need to mine that legacy. We need to look to extract the lessons from our successes and failures so we can use them to confront the current and future threats to health. And if I can contribute even a little bit to learning from those lessons, I'll be very happy.
Absolutely. And what do you think about the future of America and the standing as it relates to the rest of the world and how they view America when it comes to public health and policy advice, my friend?
Well, since the first explorers and pilgrims landed on the United States, encountering the indigenous people who are already here, there's been a fight in this country between different visions of what we want to be. And that is very acute today. There's nothing different about having different visions of what this country should be in the world. And I have seen over my lifetime, I came of age in the anti-war movement against the war in Vietnam. And we were successful working with people around the world in getting the United States out of Vietnam. So I'm optimistic that in the years to come, whether in my lifetime or beyond, we will again in this country set examples for the world about what a decent country can do. And I think we have so much capacity in public health and medical research and people with a goodwill committed to making the world a better place, that I'm hoping those instincts and traditions and history can triumph over the other histories, the ones of slavery and colonialism and imperialism and the more recent horrifying wars we've seen in Palestine and Iran and elsewhere. So I'm optimistic that once again the United States can set examples, and we'll see how that plays out in the months and years to come.
Well, Professor, I really enjoyed this discussion, and I think you're doing great work in the field of public health and social justice policy. With that said, my friend, I want to ask you, if people want to get connected with you, what's the best way they can accomplish that set goal, my friend?
Sure. So the book is available from Columbia University Press. And if you Google Fighting for New York, you'll be able to do it. I would be happy to get emails from interested people. And if you Google my name, Nicholas Freudenberg, and CUNY School of Public Health, you'll see how to be in touch with me. And I really welcome hearing from people and their lessons and questions.
Well, absolutely. Well, Professor, I want to thank you for your obvious dedication and a passion for advancing and improving public health over the span of your 5-decade career. I really enjoyed our conversation this morning. I want to encourage you to keep up the good work, and I want to thank you for your time on my behalf. It's most appreciated. Thanks for engaging in conversation, my friend.
Thank you for me, and I really enjoyed the conversation too. Keep up your good work.